All right, so thank you guys for attending this course. This is course 2. We have a total of 8 courses combined, but this course is particularly focusing on addictive patterns and behaviors and screening. So we have an agenda. Today, we want the participants to gain an understanding of the screening process, provide treatment to the clientele and addictive patterns and behavior. And it's a live interaction training. Um, It'll be available via our YouTube. Now, if you're watching it via YouTube, the biggest thing you would need to do is complete the survey, of course, pay for the course, and then we will send you your certification stating that you completed it. The total CEUs for this course is 3, and it's a twofer. So you're getting a CEU for the screening, and then you're also getting a CEU for the course material on addictive patterns and behaviors. Okay, I am BART certified. I am with the counseling board and the ICNRC, and I also put my provider number in there just for references as well. So my goal, as you guys know, is I don't want to keep you the entire time. So as you guys say, we may get out early, but of course, the board wants us to have a certain amount of hours. Okay. All right. I'm really, really big on quotes. So in our field, I always say sometimes breaking the ice is one of the biggest things when it comes to building client rapport and kind of dealing with sensitive subjects. So I love this quote. It says, "Words of comfort, skillfully administered, are the oldest therapies known to man." So I want us to kind of do a little icebreaker and tell me what is one of your favorite quotes. If you don't want to say it out loud, we have a chat feature. Just stick it in the chat feature. But mine's is, I love this quote: "A helping hand may be the only hand one gets fed from." So I love that because I always feel like in our field, we're in the helping field. Okay. What is your life quote? Anybody want to share?
A life quote that I have. This is Tamara. Is that all things are possible through your higher power, right? All things are possible through your higher power.
Love it. I love that. Thank you for sharing. I absolutely love that. And of course, when we deal with our clientele, that's one of the biggest things is kind of going through our 12-step process is admitting that there's a higher power above yourself. So I love that. Thank you for sharing. So we're going to start off with screening. Um, so can tell me what your idea of screening is really kind of what the focal point is. So I want to go over what it is. Um, we already know it's the first core functioning. And if you don't, you're going to learn that today. And how does screening work? How does it apply to the agency and the services population that we serve? And we'll briefly watch a short video. But before we go to the video, if you don't, like I said, if you don't want, you can always put it in the chat feature. Can someone tell me what is screening or define what it is to them, or what you may have known it is as it relates to counseling? Anyone?
Just making sure that everyone is eligible and appropriate for the program or process that you're going to apply them to. We have to make sure that we're putting them where they need to be or referring them out.
That's exactly what it is. Screening is one of the thank you so much, Tamara. Screening is one of the first core functions, and how it works is just that. It's really kind of tailored to the agency you may work for. If you work for your own agency, you may have your own standard of practice that you have, but definitely is one of the most important core functions. It tells you how the client is eligible, what services they're eligible for, and it kind of moves forward from there. Now, there's a short video, and you guys cross your fingers and hope it works for me. And I'm gonna briefly, and hopefully you guys can hear it. If not, we'll move forward. because you guys have it, and I'll place it in the chat. Can everybody hear this video or no? Can you hear
No.
the audio? No?
Can't hear anything right now, Miss Camille. Still no sound. I'm so sorry. I am still struggling. I'm so struggling with the sound on this video. I'm so sorry. I am not able to hear. If you can hear me, I can't hear you.
No.
Okay, I can hear now.
No. Can you hear me? We can't hear you. We still can't hear you, Camille.
Can you guys hear me?
Yes.
Oh my Lord. Okay. Thank you for being patient. Thank you, thank you, thank you. Let me start this back where we left off. Okay. And now that you can hear me. Okay, so um I'm gonna go back. Did you guys hear when I was talking about the global criteria? Okay.
No.
So screening is, as we're defining it, there's types of it where it's screening verified per your agency, and then it's screening verified for the state, and then there's a global criteria altogether. So the global criteria is what's the most universal. So when you kind of tailor in your cases, this is where the area of where the feds or global are looking at. So what we're doing is we're evaluating the psychological and social and physiological signs and symptoms as it relates to drug and alcohol abuse, and addictive patterns and behavior. We want to determine the client's appropriateness for admissions, and or the referral that is given to the agency to determine the client's eligibility for admissions and or referral, and identify any coexisting conditions. So that's medical, psychiatric. The client may come and say, hey, I already have a diagnosis of depression, but I'm also dealing with a gambling addiction, and I'm also addicted to marijuana and alcohol. So most of these may be coexisting, but are they appropriate for services? You may state that we only handle marijuana, that's our target population. We only handle special needs where our target population can be just for women and children. So even though you may treat the disorder, that doesn't necessarily mean they're appropriate specifically for your agency services. One of the other things is adhering to the applicable laws and regulations of the agency and what that looks like for the agency. So if you're going at it, let's say you're starting your own organization, you have your own business, there's a standard of practice for your agency as well as a standard of practice for the states or states you may practice in. So those also tailor when it comes to screening for those services. So you may offer everything for a client and they may tell you, hey, by the way, I'm in New York. That may be awesome, but as far as your criteria, your license, and what your agency practice, we don't service clients in the state of New York, which is also means that they wouldn't be eligible for your services. So they would either be screened in and screened out, and with that client, they would be screened out and given a referral to another agency or another one within their state of services. So let's interact, guys. One of the biggest things when it comes to screening is, are they eligible or not eligible? And a lot of times when it comes to screening, screening goes hand in hand with it comes to referral. Screening and referral are two separate services, but screening is the most important. So, we've got some case studies that we're going to present, but one of the biggest things when it comes to screening is looking at locus. So, locus is the level of care and utilization of services. So, if we have the Taylor Consulting Services for counseling, one of the biggest things is the level of care that the client can actually kind of make eligibility for criteria, which is screening. So if the Taylor Consult Counseling Services states that they only do individual counseling and that they only may do aftercare or self-help groups. If an individual comes in and they say, hey, I've been drinking, I need to detox, obviously when they call in or maybe walk in, you would still, this client is still eligible for screening, but the client would not be eligible for services. So that's two different things. Okay. So just any client that comes to you is always eligible for screening. Any client that comes to you is always eligible for screening. So that's a test question, which is why I'm saying it over and over. So any client that comes to you, they're eligible for screening, the patient, the client, but that doesn't necessarily mean that they're eligible for the services that you're rendering. Okay. One of the other thing is looking at client and patient criteria. So if we're looking at our agency, okay, we have an agency and they say, I only service women and children. If there's a male and they come in and they identify as a male, they would not meet that criteria. Now, we do have to look at more specifics when it comes to the LGBTQ community. That would be more so on the agency when we're looking at transgender and all of those when it relates to the pronouns and what the individual identifies as. But that also tailored as far as screening too. Another thing for eligibility is benefits. So some agencies, they don't accept insurance at all. Some agencies says that I only do self-pay. They do sliding scales. So well, and a client may come and say, hey, I have Kaiser insurance. We don't accept any insurance at all. Although you may be eligible for our services, we would have to refer you out if you want to utilize your insurance here. It can also be vice versa, where an agency may say that we accept Medicaid only patients. That same patient may come in and they may meet all the criteria for, let's say, individual counseling, but we can't accept them because their insurance is not in our agency or benefit network. Okay. There's other criteria that may come into play when it comes to screening, when it comes to the eligibility of the client, which is why I have the question marks of what else. Okay. Screening is another one when it's not to be eligible. So,
Excuse
what?
me, Camille.
Hmm?
I cannot see your presentation.
Oh, let me go back. Oh, it clicked out. I'm sorry, guys.
Mm-hmm.
Thank y'all for being patient, y'all. Um, is that? Can you guys see it?
Yes.
Okay. We're on Let's Interact, and this is where we were before when I talked about the global criteria. Can everybody see it? And Let's Interact is where we're at now. Okay. My apologies. So one of the biggest things is when a client is not eligible. So we have screening, what makes a client and or a patient, depending on your agency, some agencies say patient, not eligible for services. That's when we go into the agency and what tailor or target population they have. Another thing we talked about is medical coverage and financial means. A client may come in and qualify, but they may not be financially eligible. So when we start looking at maybe these community service boards, where we may see a client, the first thing they do is they base client off of income. If a client comes in and they're saying my average income is 55,000 a year, well, when it comes to some of the community service boards like Viewpoint or DeKalb Community Service Board in the state of Georgia, and also there's other agencies too. Well, they may say you're over income, We don't accept a population that your individual income can't be over 12,000, which means that individual would have to be referred out. Some agencies, like I stated before, may only accept Medicaid. They may only accept private insurance. So that means that the individual are not eligible for services. They may meet the target population. They may meet the services that the agency gives, but there's other things that make them not eligible. Care coordination is another thing. So if a client comes in and they are being going through, let's say, a referral from a doctor, and they're saying, hey, I really need the services, I've been drinking alcohol for blah 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 blah, and then the doctor or the physician may send them directly to you. At the time, they may not be eligible because your agency don't may not do detox, your agency may not do intensive outpatient. That doesn't necessarily mean they won't be eligible later. So that's another thing. Care coordination is also part of screening, where you may say, when you're done with this service, when you're done with detox, you can come in and get your counseling services under us. When you're done with an intensive outpatient, you can come and get your services under us. A client may come and say that, hey, my insurance is getting switched over to this, and that. Um, would I be eligible while my Medicaid is pending? So if somebody knows a Medicaid, most Medicaids, they back pay up to 90 days, depending on the state that you're in. That client may not be eligible at the time, but once their insurance becomes active, then they would be eligible. So then when they're not eligible, of course, that would be where the 12 core functions come in to case management and referral, which we're not going to discuss here today. But that's where we would actually issue a referral, which is as simple as saying, here's a list of community resources or a list of other agencies that may help you, or as simple as just kind of telling the client, we're not able to accept you at this time. However, this agency may. And a referral doesn't guarantee services. So a lot of times is a client, I'm referring you to the service, but that doesn't necessarily mean that you qualify for the services. Okay. Another thing may be the client may be eligible for every services. They may be eligible as it relates to medical, and the client willingness to participate in the program and services may make them not eligible. So the client may say, I don't want to do that. I want to do this. Um, I'm not willing to participate in this at time. So that alone, they may be eligible, but because they're not willing to participate or move further in services, that makes them not eligible. Any questions thus far? None? Okay. So again, we're going with the overall process of how screening works, how our contacts made, where the referral source comes in, what the target population looks like. Again, this will be tailored to the agency or agencies or how you build your agency. So if we create a fake agency, we're going to call it Talkative Nation because I like to run my mouth. And keep in mind, your referral source comes in through a doctor's office, community, and then also you post on social media and no word of mouth. So a lot of times with screening, marketing also goes in hand, how you advertise and how you get your referrals and how you get your clientele to services. Okay. So someone can refer a client to you all day, but that doesn't necessarily mean they are appropriate for your agencies or the services you provide. And that's anywhere. This isn't just tailored to counseling. We know if I go to the doctor's office and make an appointment and I have a blood gushing wound, they're immediately going to send me out to a higher level of care. The same thing if I go into a shoe store and ask for a burger. They're going to say, we don't sell burgers here. You can leave. So screening is universal. It's not just tailored to counseling. One of the biggest things that we're looking at is the target populations is adults only. We specialize in addictive patterns and behaviors, and this is what the fake agencies that we're creating. So one of the biggest services that we offer is a 10-week intensive outpatient program, which is what IOP stands for, and we also do a step-down clinical services. So, of course, how screening works is you would need to know that Now, shout out to these agencies that may throw you in and not train you. So then, when you're doing the initial screening process, or a client may say, hey, how do I work for, or how do I get services from your agency? You would literally need to know the services the agency offers, and the criteria, the target population when you're screening clients. Okay. So I'm going to do a case study. So this is the presenting problem when it comes to this case study. And what we're going to do is do some interactive of whether and how they're eligible for services. What further questions do we need to kind of dig and request? So one of the biggest things is you're a licensed mental health counselor. This is the presenting problem and concern. And a community agency, your client is self-referred, which means they came in on their own. There was no other agencies or entities that came into play. And this is what the client presented. They said they came in because their mother won't stop bugging them. And they're saying that they're staying in bed all day. They can't help it. They even kind of explain their behaviors, that they're in a rut. They reported that they feel hopelessness, and these behaviors and concerns started about 3 months ago, and these symptoms. So the client went on to say that their divorce was finalized at the time, and even though their ex had, well, both of them have grown apart, the client feels sad. So the client's giving us a lot of fluff and bluff. This is exactly how screening may go. Well, the client may give you a lot of information, but that doesn't necessarily mean that they're appropriate for services, and that doesn't necessarily mean your part in the screening is over. Going back to the case study, after calling in sick for 2 weeks, the client says that she was terminated because she didn't provide a doctor's note, and now she is experiencing financial difficulties. Okay. So she goes on and says that she has to uproot her children, move in with her mother, and she feels like she's failed at everything. Clients share that she feels sad and empty and anxious most days. Disclose feeling sad. I can't remember the last time I enjoyed something. Then I think I could be doing more for my children. She goes on and talks about her feelings. Okay, this is the first case study. The biggest thing is when it comes to screening and the fake agency, what information do we need to request? And is this client appropriate for the services that we offer? Okay. Next case study. Okay. So this screening focus is the lifestyle, the habits, and then also what is going on with their health, their intervention. Is this client eligible for services? Okay. So the client is a 45-year-old man. They've been hospitalized 3 months prior for chest pain. So we've got some medical concerns going on here too. In this presenting issue and concern, there's a clinical case for this young man or man. They are unhealthy use of alcohol and drugs, and they present for their primary care physician who's complaining of heartburn and chest pains. Okay. So there may be other medical issues that could be contributed to the client's drug use and abuse. Okay. So the client denies weight loss, vomiting, all of these medical. He gives backgrounds that the client's married, they have a daughter, and a son, and kind of gives into the flood of the last time he visited his primary care physician, the physical examination. These are both the presenting issues that the clients are presenting to claim eligibility for services. Okay. So let's discuss this. We've got two cases. Okay. What is the screening process for each one? So focusing on case one, where do we kind of tailor all that information that was presented? Anybody can jump in for me.
Okay,
And
so
mhm.
I don't know if you remember Camille, but I'm very new at all this. So
Sure, yeah, come on in.
um
Yeah.
I mean, I would think that maybe you want to inquire about her background, like in terms of the depression. Sounds like she's going through some sort of depression. Is there a history of depression? Has she been seen or treated before by any other facilities or doctors, what have you? Is she on any kind of medication? I don't know. Let's just kind of off the
That's
top of my head.
that's exactly the direction you actually did very well. And like I stated, even with you being new, everybody uses screening. It's a very universal tool. But your biggest thing is, you like you stated, you've got to get more information. How long have you been depression? The client gave you a whole bunch of fluff, fluff, fluff. And what do you basically what you stated is, how do we get this information? Same thing for case two. With the gentleman, he's got all these medical concerns. And with the fake agency, we offer intensive outpatient. Okay, now the person may be eligible for services as it relates to their drug and alcohol, but we would have to get way more information as it relates to when was the last time you drank, what medical issues, are they medically stable? Just because a client may be eligible, are they medically stable, are they medically sound? Going back to case one, there's another one with the screening. Do they, just because they're presenting the depression, is there any underlying addiction? Is there something that we may have missed? They may, the primary may be the depression, but is there any underlying other conditions too, medical and so forth? Okay, you guys with me so far? You can give me a thumbs up or a clap, or I don't know what these little signs are below. Um,
Yes, we are on a roll.
oh, we are on a roll. See, I told you, Miss Taylor, I'm gonna get you in and out. I told you, okay.
Thank you.
Okay, so that's one of the biggest things is when we do screening, we've got to put it into practice. All right, so now we're gonna review. We want to explore what we've learned thus far about screening, with the importance of it, and why it is one of the most 12 important 12 core functions. Okay, so thus far we've learned that screening is universal. Go ahead, Selena, I'm sorry.
Oh no, I pressed it accidentally. I was trying to look for the little reactionary things. I thought put my hand down. Sorry.
Oh, okay. Thank you. So one of the biggest things we learned thus far, it's important, one of the most important 12 core functions. We also learned that screening and referral are two separate services. They're not one and the same. Another thing that we've learned thus far is screening is tailored specifically to the agency. There's a global criteria, there's an agency criteria, and there's also one as it relates to legal and laws and regulations. Okay. Anyone has anything to add thus far?
No, I think you're doing a wonderful job.
All right. Thank you, Miss Taylor. I appreciate that. Okay, so it's time for a break. Um, if you're doing this online, you could take 10 minutes and come back. Um, I don't know with you guys. I know Miss Taylor always tell me to keep going, but I would just take a 10-minute break, and then prepare for the quiz, and then we could kind of take it from there. Do you guys want a 10-minute, or you want me to keep going? It's up to you.
It's
Yeah, I knew you were going to say that. Selena, what do you want?
Oh no, we can keep going.
I know.
no.
But you're the one presenting, so if you need to take a break.
I am good. I love to keep going. And most of the times, you guys know I instruct as well at the university. My students like me to keep going because they get out early. So,
Yeah.
so we're going to do a quiz. You can either write your answers down or type them in the chat. Okay. And then we'll discuss the questions. You tell me when you're ready. I'll read the questions. They're also on the screen as well. And all the questions are true and false. No, I'm not doing any multiple choice or fill in the blank. Okay. Take your time. It's no rush. And then we're going to discuss the answers. Okay. So, question one, screening is the most important 12 core / counseling function. True or false? Screening is defined as the process for evaluating the possible presence of a particular problem and or concern or eligibility for services. True or false? Screening is the same as a referral for services. Screening, true or false, sorry. Screening identifies any coexisting conditions that may indicate the need for additional professional assessment or services. True or false? And the last question, the two case studies presented, both are eligible for screening, true or false? And just take 5 minutes and we will review. How are you guys doing thus far?
I'm done.
You're done. Miss Taylor, you're good?
I'm, I'm ready.
All right. Okay. So you don't have to reveal your answers because you guys all passed. So the first question is, what did you put?
Of course, true.
True.
True. True. And you guys are going to see my pattern after a while. What number two, true or false?
True.
True.
Awesome. So number three, true or false?
False.
False.
Yeah. Number four, true or false?
False.
True. Oh,
We got two different ones. Tell me,
Yeah.
tell me. Okay, so who said true? Who said false?
I said true.
It's true.
Okay.
It's true. Yeah. And that's a SAM show. So screenings identify any coexisting conditions that may indicate the need for additional professional assessment of services. That's straight out of our SAM show. Who's like the regulations for substance abuse and mental health. But they're stating that we should be doing that process in screening. Ms. Taylor, you're with me. How often do we do that? I'll
I
move on. Okay. Most of the time, that comes during the intake and when you're doing the assessment. Okay.
okay.
Um, the last one, true or false?
True.
Very. Anybody that comes to you is eligible for screening. No one gets denied for screening. Good
That's
job.
yeah.
Mm-hmm.
Mhm. Any questions?
I got an 80%.
Yeah, come on. That's the goal, 80 and above.
Take
But
it.
So everybody, as you guys know, your past. That's my whole goal. I didn't want to make it difficult because at the end of the day, you're going to do your job. Okay. So
Mhm.
moving forward to our next topic, and let me know if you need a break. Take your breaks if you need it. The biggest thing we're focusing on next is addictive patterns and behavior. So our concern is what is the pattern of addiction? That's our biggest focus. So this beautiful, beautiful, beautiful chart talks about the behavior, the thoughts, and feelings. The in the center focus is, of course, the individual themselves, their core beliefs, the futures, and others, and how they're all kind of correlated. So we're looking at the types of addiction. Okay, we already know about substance abuse, drug abuse. Substance abuse and drug abuse is one and the same, but I'm going to put it down. Behavior addiction. And can someone tell me what would you define addiction as? What is that?
Addiction is a brain disease, a chronic brain disease.
It is in the newer age where we're moving from salutogenic and not pathogenic, where before we would just focus on the problem and solution and that it was a disease. Now that we're moving forward, we're mostly focusing on salutogenic. So addiction is definitely a brain disease. It's a neurological dysfunction. There are patterns of addiction, which we'll get to. I just listed two here with experimentation and regular. Stages of addictions are, we're going to all explore these, and behavior addiction. So I'm going to kind of move forward and explore. So I want to kind of discuss what experimentation is, what regular use is, what risky use is, and dependence. Those are one of the biggest things when it comes to addiction. Craving it, um, frequency use, compulsion use, and you continue to use despite of the consequences. That all goes with the stages of addiction. Anyone knows what experimentation is?
Just trying it out,
Mhm.
um, experimenting, just to see. I don't know what the effect will be.
That's actually spot on. Some people are just exploring. Let me try this. Went to a party, they had cocaine. Let me try it. Oh, it's marijuana. Let me do some X. And that is literally what the individual have. Some individuals, they'll come to you, and that's the stage they're at. They just experiment. Only do it when I go to parties. Only do it when I do this. Um, when it starts escalating to regular use, that's when every Friday I do it. I only do it when I'm alone. And then when it starts getting to risky use, risky as well as a lot of times people look at it as if you're doing or engaging in some type of illegal act to get what you need. Risky can also be if you're looking at an overeating where you're already at the stage of abuse, obesity, or now you've got these severe medical issues, but you continue to do it. That also can be looked at as a risky use. Using dirty needles if you're looking at it from a substance use and abuse. And then when someone becomes dependent on it, that's what we were also talking about, the brain disease. Now you've trained your body that it needs it. If I don't have it at this time, we actually have some type of physiological reactions from it. Okay. So I'm going to try to pronounce this doctor's name, Heshmack. This is the study that Dr. Heshmack did on addictive behaviors. So, and the signs to actually look for. So they said unsuccessful attempts to quit, loss of control, cue trigger, relapse. This happens quite a bit. Sadly, in our field, most of the time when you see the client, you're going to see them again. And not just in the drug and alcohol field, in the mental health field as well. Desire without pleasure, staying vigilant in doing it. And some of our clients, they self medicate. They don't want to take the prescribed medication. So they say, I rather utilize marijuana. Sometimes they abuse meth or whatever other drug because it aids in my feelings. It aids in my schizophrenia. The voice is not being as loud. Sometimes there's a cross addiction where they may have alcohol and then it kind of coincides with a gambling addiction too, and they get the same effects from both. And then sadly, genetic vulnerability. Genetic vulnerability is when they either have seen the familiar behaviors in their family or this behavior just runs in the family. Addiction is not limited to substance abuse. So, one of the biggest things I want to focus on behavioral addiction disorder. So, what is behavioral addiction? I'm not going to read all of it, but I'm just going to briefly kind of go over it. Operant condition, we're going back to behavioral or sociology 101. Um, where they did the study with the dogs, but they suggest that behavior is followed by a rewarding experience. So this could be an animal and or individual. So they become more likely to repeat the behavior because it's rewarding. I like to eat because I like the way it tastes. It's satisfying. Same thing as if I like to drink. Same thing when I like to gamble. It's rewarding in some way. I'm I win. So a lot of things of addictive patterns and behavior is it may start off as a stress reducer. A lot of our target clientele, they say that I had a stressful job. I'm dealing with stressful things in my marriage, in my relationship with my family. So to aid in my stress relief, I go shopping, I get on the internet, I play video games. So that's usually where it kind of starts, and then it becomes into a higher form of addiction. Okay. So they'll continue to engage in the act because it's a stress reliever. Also, it's defined, behavioral addiction is defined as an intense desire to repeat the same action as stated before because it's pleasurable or it's seen or perceived to improve the well being or capability of alleviating some personal distress. Okay. Classification of addictive behaviors is the difficulty that those that have been affected with reducing participation in stopping it altogether. They try, and this is the same thing when you see substance use and misuse, you'll hear it quite a bit. I've tried to manage behaviors, I've tried to decrease the behaviors. I just can't do it. So, according to the study, um, with the Dr. Bayet, and I'm gonna try not to butcher their name, their study states that those who become addicted to specific activities seek out feelings of comfort, happiness, and chemical releases. So we're dealing with dopamine and serotonin, and these form of behavioral addictions escape reality or painful emotions. So one of the biggest things that's attached to behavioral addiction is the accessibility to them and the excessiveness. Those are one of the most, well, the top two when it comes to behavioral addiction. Behavioral addiction types. Okay, there is a short video. I'm not going to even attempt. I'm going to put it in the chat for you to review. But with the short video, it is with Dr. Bayat, and they're explaining, it's 1 minute, the type of behavioral addictions. Okay, I'm trying to copy it, y'all. And I'm putting it in the chat. Um, One of the biggest things you should know is shopping addiction isn't classified as a mental illness, rather compulsive buying. A lot of times, I don't know your experience, Miss Taylor, but a lot of times we get a lot of clients who shoplift and they have to come and see an addiction counselor. And they have to take a certain amount of classes, but it's actually not considered a mental illness. It's more so looked at as compulsive buying, that may be associated with other mental health when it comes to the shopping addiction. And the stealing for shoplifting is what you guys remember how they say klepto, but they're actually not one and the same. So shopping addiction is the compulsive buying, and then a shoplifting is when they're stealing. Another thing is someone can overexercise. These days, you see people addicted to plastic surgery, gambling. People can be addicted to toxic relationships. A lot of times, when it comes to toxic relationships and being addicted, most of the time they're tied to domestic violence. Um, most relationships, thrill seeking activities, most of the time, thrill seeking activities. You see that a lot with gambling. You see that a lot with people who like to um, drag race. One of those two, they're addicted to it despite some of the consequences. They may have been injured, but it's not going to stop them from doing it. Video, sex, internet, shopping, binge eating, food addiction. We also see it with people constantly picking at their hair and skin. Those are all types of behavioral addiction as well as overworking. You guys with me so far?
We
Yes. So all those things that you just mentioned are, is it just some of them that's not considered mental, or all everything that you just mentioned? The you said the shopping, um, you know, the stealing, not being a klepto. So none of these, those are not mental. They're
That's a
just
very good question. So some of them are, most of them actually are.
okay.
But when it comes to the DSM criteria, which is the Diagnostical Statistical Manual,
Mm-hmm.
some of them aren't. It's more so just looked at as behavior. Now, when it comes to binge eating, food addiction, that is definitely a mental illness. Gambling's a mental illness. Toxic relationships, and addiction can be a mental illness. Video gaming too. And towards the end of the presentation, well, the middle, I should say, we're gonna break some of these down as it relates to mental health disorders as well,
Okay. Thank you.
because they can be one and the same. That's an awesome question. Go ahead, Miss Taylor. What was your question? I'm sorry.
Oh, I'm sorry. I didn't have a question. I was just saying we were on the road. You were asking how you were doing and if we had any.
Awesome. Awesome sauce. So, behavior addictions, the brain and emotions. This is still dealing with Dr. Bayad's study on addictive patterns and behaviors. So there are motivating factors when it comes to behavioral addictions. Okay. So this includes the perception of temporary decrease of depression symptoms or anxieties. You see this quite a bit when it comes to addictive patterns and behaviors. They're not usually, but most of them, according to statistics, are tied to depression symptoms and anxiety and perception. And a lot of times that individual's perception can be tainted. One of the biggest things they perceive is their level of calmness or being calm or happiness. One of the biggest idea is looking at sex addiction and gambling addiction. If you have ever dealt with somebody who gambles, one of the biggest things they tell you is there's certain parts of their brain that lights up. They talk about, oh my goodness, hearing the coins and the slot machines, and looking at the different type of gamblers where they may go in and just go in for the thrill of it, the action gambler, and it breaks down studies into the dopamine, the rush. Some people have the escape gambler, which is a whole nother training. But this is one of the things that Dr. Bayat shows, that there is similar brain activity also with shopping and sex addiction, as well as overeating, where there is some type of the brain that lights up in its gratification when it comes to this. So, going into pornography, because sometimes people may have a porn addiction, and that's also classified as a sex addiction. So with this, these behaviors may have unhealthy or complicated relationships, because they struggle to gain control of the sexual behavior. They will also be followed by shame and regret, but that doesn't necessarily mean the individual is going to stop. As stated earlier by Ms. Taylor, this is a brain disease. So this is a process. They're not going to stop on their own. The inability to stop these compulsions associated with the behavior and addiction is a possible sign of behavioral addiction. Any questions? Jump in if you have them.
None at this moment.
No? Okay. Behavioral addictions and mental health. So this is where you are coming in, Miss Selena. This is important. So one of the biggest mental health that we're seeing quite a bit, sadly, that is heightening, not saying it wasn't always, after COVID is BED, binge eating disorder. Now, this is not new. It's always been around, but we're seeing this quite a bit at a highness because of COVID. We're also dealing with excessive eating amounts of food. I'm going to try to say this right, polyphagia. If somebody jump in, and hopefully I didn't say that wrong. Compulsive sexual behavior or hyposexuality or sexual addiction, that is a mental health. Compulsive gambling or compulsive gambling disorder. Internet gaming disorder. Now, internet gaming disorder, people want to say it's fairly new. It's really not. Um, it's been around for some time, but we're dealing with this quite a bit because you have people that spend hours on the video games. You spend hours and not moving, playing it all day, and it's the same type of dopamine rush as if you use the substance within itself. Toxic relationships and addictions, also that is a disorder. And like I said, most of the time you see that connected to some type of domestic violence. Okay. Now, they do have some underlying mental health challenges. So, those that become addicted to these specific activities, they, as stated before by Dr. Bayat, they're seeking comfort, happiness, and those chemical release of dopamine and serotonin, they start to feel really, really good to them. So, those forms of behavioral addictions, they escape reality or painful emotions. Some of them also can have some underlying trauma or who know else. We won't actually know what's really going on until they kind of get into treatment and start treating the behavioral addiction from within themselves. So behavioral addictions impact the part of the brain. What you stated earlier, Miss Taylor, and individuals can experience similar effects that would feel like they're abusing a substances. So behavioral addiction is just as real and just as serious, to the level if somebody is drinking alcohol, if someone's abusing any type of illicit substances, if someone's smoking cigarettes. And a lot of times with behavioral addiction, they're always tied to a co-occurring, not all of them, but I should say most of the time they're tied to a co-occurring disorder as well. So identify any questions, I'm sorry, any questions before we move on about the two? Because I know, Selena, you were looking at the mental health disorders.
No, that clears it up. Thank you.
You're welcome. Identifying and treatment. So we can identify the signs of behavioral addiction and then also look at some different treatment methods when it comes to the recovery process. Okay, so there's a sign of behavioral addiction, and these are some of the signs. These are not all. These are just the ones that have been proven by research that we can look into. So when we're identifying this, feeling shame or guilt or embarrassment after doing the activity, the inability to stop or control, the doing more risk taking, and you see this a lot when it comes to gambling, when it comes to someone that may do risky behavior as far as racing. They continue to do it even though it could kill them, even though they have drained all their funds. This is the same thing when it deals with overeating. If you guys have watched that show, My 600-Pound Life, where those individuals, they could die, but they continue to excessively eat because, as stated, they're addicted and this is a disease. And then some of these individuals, they experience cravings from doing the activity. You see this a lot for people who excessively exercise. I have to do it. I don't feel right without. I haven't did it today. They'll be exercising 4 or 5 times a day. Sometimes they'll spend hours in the gym. And a lot of times those are tied to body dysmorphia, binge eating. Sometimes there's some other level of behavioral addiction, not just tied to the over exercising and using the activity to justify the deal with trauma or poor mental health versus getting professional help. So there's mental health tied to the behavior as well. Okay. So there are some treatment methods. We always stick with the 12 step groups. There's also self-help groups. There's a Gamblers Anonymous. There's Overeating Anonymous. There's trauma recovery groups. There's a Shopaholic Anonymous. There are so many self-help groups, and most of them now, because of COVID, they're virtual. So a lot of those resources, where a client may say, "Hey, where do I go? I finished the program," or "I don't think I'm ready for the program." That's a good starting point of, okay, you've got some gambling addiction concerns. Why don't you try going to Gamblers Anonymous? And some people may say, well, I don't want to go in person. Most of those services are offered virtually online as well. Counseling in individual or group. Most of these behavioral addiction, and I'm going to say most, have some type of group therapy, intensive group therapy, which is a higher level of group where they're meeting at least 2 to 3, well, it's 3 to 5 times a week, for usually 2 to 3 hours, mainly 3 hours. Counseling individual. There are treatment methods in place. We also have smart recovery strategies as well. So there are several um, treatment methods in place, and there's hope for recovery, just like it is with any other addiction. Any questions?
No questions.
No. Okay. All right, you guys ready for number 2? Question 1. These and all the questions are true and false. The inability to stop compulsions associated with behavioral addiction is possibly a signs of behavioral addiction. True or false? Behavioral addictions can form similar dependence on drugs and alcohol to combat mental health disorders. True or false? Shopping addiction is classified as a mental illness. True or false? Feeling shame and or guilt after doing an activity can be a sign of a behavioral addiction. True or false? Behavioral addictions are just as serious as substance abuse and alcohol addictions. True or false? And take about 2 to 3 minutes or 5 minutes, and we'll go over the answers. How y'all doing?
I'm good.
Good.
You are
You ready? Okay.
Yes.
Okay. So number 1, what we put.
true.
True.
Correct. Number 2, what we got.
True.
True.
Correct. Number 3, what we have.
False.
False.
Yes. Number, wait, y'all on 100 now. Number 4, what do we have?
True.
True.
Come on. And number 5, last one.
True.
True.
So y'all all passed.
I
Okay.
need. I needed that.
For number 5,
I need the one on this quiz.
that's 100. Okay, so you got the answer. So you probably wondering how I'm gonna get my certificate, how I'm gonna. You're gonna get it. So what you have to do is complete the survey. I put it in the chat. There is a link. I will do it again because I don't know where our message went. Probably because I logged out. This is it. I'm gonna copy it so y'all have it and put it in the chat. It copies right. It did not. Hold on one second. Did you need to have it? I don't want it to open up, but it will. So must complete the survey. Make sure your email is attached. You'll get a completion certification. So it'll be broke down into 2 sections. So you'll get a CEU for completing screening, and then you'll get a CEU for completing the addictive patterns and behaviors as well. Okay. We've got some up and coming trainings. July 21st, we're doing a training on conducting assessment and assessment tools. And then on the 28th, it's Black Women in Trauma, same time. I promise I'm going to get y'all in and out. I know it may say 9:30 to blah, blah, blah. That's the board, and I have to set a certain amount of time to do it. But I'm gonna try my best to get you guys in and out. I try to get you out in and out in an hour and a half or so. Okay. There's a registration form if you're not already registered. Look on our website. We also have treatment programs that we do completely online on binge eating, and then also overeating is our focus, but we only focus on addictive patterns and behavior. We're not a weight loss program. We only do addictive patterns and behaviors, as stated before, and we focus mainly on minimizing, decreasing, and alleviating those behaviors. Any other questions?
Not for me.
No. Okay, these are references and resources. I did not get this by myself, so I want to make sure I get credit to the resources and collaboration material that I utilize. And that is it. Okay. The form survey again is at the bottom. Please complete it. Once you complete it, you will have your certificate within 24 to 48 hours. Okay. And I thank y'all for participating. Any other questions?
Thank you. I really enjoyed the course.
Thank
Have a great.
you guys too. Thank you guys both for participating in the addictive patterns and behavior and screening. And enjoy your day. I hope I didn't keep y'all too long.
Bye, everyone. Thanks.
Bye. Again, if you're watching online, this is for addictive patterns and behaviors and screening. If you want to get credit for this course is $45. You can follow the link here, which we'll have in the YouTube description, and also register here. So watch the video in its entirety, and then you can email here, complete the survey here, and then if you want to register for any more of our courses, you can. And enjoy your day. Bye.